Lord. Here we go. All right. Hey, Science Fam. I'm here today with a good old friend of mine. He is, I should say, Dr. Chase Williams. Is that the proper terminology?
Technically, yes.
Yes. But known Chase a while. Great background story. I was in an incredibly talented heavy metal band with him called Sixth Sense freshman year of high school. Was that our name?
One of them, yeah.
We changed it a lot. But anyways, the reason I wanted to introduce you guys to Chase and hear his story is because he's taken science and he has an incredibly unique and interesting path that I think has shown a path of success, but also a path to some different changes in that, which I think is very valuable for you guys to hear. So Chase, if you don't mind, I'd love for you to start off a little bit with maybe of kind of your high school to college experience transition and kind of where you went from there. And eventually we'd like to end up with what you've done and what you were doing today. And if there's any overlap between things you wish you would have known, etc., we are all ears. We are the students and you are the teacher.
Sure, absolutely. Thanks for having me. I appreciate it. So my name's Chase Williams. I'm a pharmacist by background. So I guess I'll kind of start there. So, and then just going back to high school, went to school with you, and really enjoyed that. And so I think in terms of thinking about science, what really introduced me to being really passionate in pursuing a career in the science field goes back to my sophomore year in biology. And the teacher I had was just super passionate and really kind of engaging. And so that's what kind of got me driven down the path of science, really. And so from that perspective, I excelled in my biology class. And then I was bumped up to honors chemistry. In that class, I didn't excel so much. Probably less motivated based on some life factors. My dad passed that year. And so, really struggled with chemistry. But made it through and then took on anatomy and physiology senior year. Had that same teacher that I had the sophomore year in biology who really inspired me as well to kind of pursue the path, not only science, but healthcare as well. And actually, I remember I was on a field trip and both of my teachers were talking together at this field trip, and my anatomy and physiology teacher told my chemistry teacher that I wanted to be a pharmacist. And she just laughed and laughed and laughed. And so, not that that really drove me, but I can think of that as kind of an influential moment where kind of that, really started to create the drive to do that. And then from there it was, okay, well, what path do you want to pursue in healthcare? So really I was kind of thinking about between pharmacy and medical school. But didn't really know what direction I wanted to go in. So started off at the University of Illinois Chicago doing my kind of pre-med, pre-pharmacy coursework, mostly along the sciences, and got a job actually as a pharmacy technician through a friend at Walgreens just to kind of see what my thoughts are, if I enjoyed it, and I did. And then continued doing my pre-pharmacy work. After about 2 years, to be honest, it was kind of a struggle in undergrad because of funding and paying for things and such. So at the 2-year mark, I'd completed my pre-pharmacy requirements. So essentially just decided to apply to pharmacy school, take the PCAT is the test that you have to take to get into pharmacy school, similar to the MCAT. So took that and applied and got accepted and just decided to kind of go down that road in pharmacy school. Absolutely loved pharmacy school, completely different than kind of the undergrad requirements in terms of, you have to do English, you have to do all these other courseworks. And for pharmacy school, it was mostly just science-based, so I really just not only loved pharmacy school, but excelled there as well. So just going back, in undergrad, I almost dropped out to join the Marines, but decided that thinking in terms of the Marines don't have healthcare, and naturally science was kind of, what I was really good at. So I decided to wait on that. And in pharmacy school, it was my last year of pharmacy school, was kind of exploring what opportunities existed for me throughout that path, and actually still had kind of this urge to join the military. So went and talked to an Army recruiter about the kind of the package that they offer for officers coming in as a healthcare provider, and decided actually my last year of pharmacy school to join the Army. So transitioned, graduated pharmacy school, and waited about 6 months, and then went to officer training in San Antonio, and that was about 10 weeks long. And throughout my time in the military as a pharmacist, I had the opportunity to really do a number of different things. Went to South Korea for a year as a assistant chief, ran the hospital pharmacy there. Spent a lot of time in Texas at a trauma center there, and a number of different operations, and then deployed with a combat support hospital to Afghanistan, and ran the pharmacy there. So from that point, I got out of the military after my deployment, just because of the family life. My son was 10 days old when I deployed to Afghanistan, so we decided that I'd kind of completed what I wanted to accomplish there, and then went back to retail pharmacy for a little while, and then got involved with the pharmaceutical industry, and that's kind of what I currently do now. So I've done a number of different positions within the pharmaceutical industry. Right now I work for a company, and we focus on HIV, hepatitis C, hepatitis B, and we're actually currently working with COVID-19, actually. We have one of the drugs that's going through clinical testing. It's called remdesivir. President Trump says it often, and often incorrectly. And so what I'm currently doing now really is providing education to physicians, healthcare providers around the disease states that I cover. My official title is called a medical scientist, and so I serve really as the liaison between my company and healthcare providers and physicians to educate them and update them, work from a research capacity to identify clinical sites that we could collaborate with to do research as well.
Okay, so if you're kind of the liaison in that, it sounds like communication is a huge part of your job. Is that something done in person, virtually like this, or is this are you traveling, or is this a local Chicagoland area? Could you kind of maybe talk a little bit more about that? That's interesting to hear in your daily life, what your job would be like, maybe pre-COVID-19 would be.
Sure, yeah, absolutely. Yeah, so communication is absolutely key to my position. I would say even more so than actually, obviously the clinical knowledge needs to be there, but more importantly, it's how do you effectively communicate that knowledge to providers. And I think that goes without saying in any field, whether you're a teacher, whether you're a pharmacist, doctor, nurse. If you can't communicate the information that you learned, then it's not really worth anything. So to your point, that's absolutely critical. In my role, outside of shelter in place COVID-19, all of my communication largely is done in person on a face-to-face basis. So I actually cover 15 states. So I travel to different healthcare systems, different hospitals to meet with different doctors and opinion leaders within the field, set up meetings, dinners, lunches, breakfast, whatever the case and format may be to align with their needs. Presenting's also another part of that. So doing scientific dinners where I would kind of organize, say, 10 different physicians to come to dinner, whether that be either me presenting to them, through PowerPoint or a slide deck, or whether it be more collaborative and just kind of a roundtable engaging and exchanging dialogue on treating a certain disease or using, a certain medication.
So if you are meeting with different doctors and movers and shakers in the industry, is your goal, representing your company, to introduce them to different, and forgive me if I'm using the wrong terminology, different medications or whatever that they might not even know about yet?
Yeah, absolutely. So in the pharmaceutical industry, you have two different segments. You have the commercial, which is sales driven, right? So they have an aligned message and strategy that says, we want to sell our product. And then you have the medical component, and that's more non-biased. So my role is to educate them on whether that be new data that's out, a new medication, and then they can make the inferences and decisions that they want to based on the data that I've presented to them.
That's interesting. Yeah, I imagine there's just the world is so big. There's so much new things being introduced every day. I imagine your job and your role is incredibly crucial because I would imagine physicians, especially in a specialized field, just get bombarded with information every day. It must be overwhelming to sift through that to not only practice in your field and do what you need to do, but also learn new knowledge. That must be overwhelming.
Yeah, they don't have time to do it. It's just unrealistic.
Yeah.
There's just so much information. It's constantly changing and evolving, and treatment strategies just continue to change as well.
Wow, incredible. So what is it about your job that you enjoy? Maybe what's one of the most things you enjoy most about your job currently?
So I think, there's a number of different things. So this role in particular, actually, I'm focused around the Veterans Affairs in the Department of Defense. So I actually get to work specifically with the military doctors that maybe I used to work with, or the healthcare providers that actually treat veterans. And so the most rewarding aspect from that perspective is being able to have an impact, even if it's not directly on that patient or that active duty soldier or that veteran, but I'm having an impact overall on the treatment they receive. So that's kind of.
Yeah, well, it's amazing. First of all, the service you did for our country. Thank you so much for that. And just the fact that the industry you're in now is all about really helping and benefiting people. That's incredible and something that should be applauded. So thank you for all of that. When you look back through your path and career and opportunities, I love that military is a part of your story. Did you feel like that was something that opened up opportunities for you that may not have opened up if you would never have went that route through the military?
So that's a great question. And I think, it's presented a lot of opportunities and it's presented a lot of challenges. So actually, when I was in Afghanistan, I had made the decision that I was going to be getting out and actually resigning my commission when I got back. And so I had actually started to apply for jobs. So I was, applying to positions, sending cover letters saying, well, I'd like to speak with you, but I don't have a phone number you can call me at.
Right.
So I think I was comfortable with what I was doing and that's all I knew. So that was an adjustment to make in terms of adapting to, well, how do you take my military experience? Because I did things that really weren't translatable to the civilian sector. So how do I kind of package that into language that makes sense? But also I did so many different things that it was hard to say, okay, you apply to this job now and you're kind of like the subject matter expert as opposed to a jack of all trades. But ultimately I've been the experiences from as a people manager, the life challenges that I experienced have ultimately benefited me far more than anything else, based on what I was exposed to basically in the military.
Yeah, I think you bring up a good point. Me as an educator, of course, I think learning and education is important, but I think what you're saying, and I could 100% agree with you, forgive me if I'm saying it wrong, but I think experience is one of the greatest teachers, and the things you've gone through, through high school and also through the military, et cetera, and that really do shape the person you are and how you handle situations. And that's something that just comes from your environment and living versus what we learn out of a textbook or that.
Yeah.
Yeah. So excellent. Forgive me. Hopefully I'm not interrupting. If anything else you wanted to say, quick question though, with all the path you've taken in that, is there any skills that you've seen either in yourself or others you've worked with that you felt are really important or really crucial for the success of anyone or anyone in the science field, but any type of advice in that way, I just think is great for myself to hear, but also my students as well. We're all ears.
Yeah, so I think, we mentioned communication. So I think that's a huge aspect of it. I think for, as students, the ability to be able to network with the technology that we have now. LinkedIn actually has been a huge resource for me. And in some markets, it's really changing the dynamics around how people get jobs in terms of an internal recruiter at a company can now look at all of the available candidates or potential candidates as opposed to people just submitting resumes for a certain job. And so
Right.
I think that's changed the dynamics of the market. And then also just being humble and just realizing that we all don't know everything, and learning throughout the journey, and asking questions. And I think the more that we do that, the more we can learn from each other, and the better we get along with the colleagues that we work with. Um, you know, Most of it is about people being people and people interacting, and people like to work with each other, and that's what makes really businesses thrive. And that's what makes people thrive within the companies that we work with.
Yeah, well said. I think those things you pointed out, we coin a lot of times as soft skills, but it kind of doesn't do it justice, because those quote soft skills are probably some, like you said, the most important things. As humans, we have to work together. And if we don't possess those skills, it becomes really rigid in order to do what we're all,
Yeah.
in teams to do. So well said. And that's a good plug for all of our communications, English classes that sometimes my science students roll their eyes at, including my son, who seems to be more science minded right now. Why do I need to write so legibly? But you got to take pride in your communication. Otherwise, what you know isn't that valuable, like you said, if you can't let someone know what you know and help out in any way. So excellent. Thank you for sharing that. Quick question. We are D230 school. We went to D230. Do you remember the name of that wonderful teacher that you had by any chance?
Mr. Ironman.
Mr. Ironman.
It's interesting. I've looked for his contact information throughout the years. I looked for him on LinkedIn because honestly, I wanted to reach out and say thank you for what he did. So that's important.
Yeah, I'm the same way you. I went into the field of science because of a specific teacher as well. So it is incredible how one person can totally change the trajectory of your life, but vice versa. I get nervous because maybe I've ruined it for a lot of people too.
But all it takes is one.
Yeah, one to ruin it and one to make it, man. Pressure, no pressure. But Chase, sincerely, I want to thank you for your time. Your story is incredible, and that the experiences that you have are so different than so many people in that. And I think my students can get a lot out of this, from the options of the military and the different opportunities that could bring, and challenges, like you said, the field of science and pharmacy in general. You ended up going to Midwestern, which is fairly local to a lot of our students. Is that technically Lisle, Oak Brook?
Downers Grove, yeah.
Downers Grove, forgive me, Downers Grove. So actually not too far from where I'm at. I'm in Woodridge now. But that experience with pharmacy school, and that after you did the 2 years of your pre-pharmacy, was it another 3 or 4 years?
It was 4, yeah.
4 years, so 6 years total.
Yeah, so it's typically 6 to 8.
Right.
Yeah.
I remember you being on the accelerated path. You were down and ready to get this going and get into the force. So that's awesome. As far as that, I think that you being a pharmacist, that must establish immediate credibility in your job. I mean, when you're talking to people, you obviously are a person with the science background and the ability to convey that message to other people. Are many people in your job position, are they also technically pharmacists as well?
Pharmacists, MDs, some PAs, but mostly pharmacists and medical doctors.
Awesome. Cool. So if you're interested in the science field and you like traveling and people, this sounds like a great potential opportunity for some of my students in the future. So this is a great showcase of different opportunities that science and those doors that are open because of it. So I really want to thank you for just explaining that and kind of what your job looks like, because I think we always talk about, what science in the future, but we never get that tangible example of what that is and what you do. So thank you so much for that.
Sure.
All right. Well, on that note, Dr. Chase Williams, I'm going to officially hit the unrecord button so that we can stop this conversation officially. But students, I know you're already thinking in your head and that to Dr. Chase Williams. A lot to learn from different people. And as Dr. Williams said, staying humble and knowing that you don't know everything and learning from others should and could and will take you pretty far. So thanks for those awesome words, Dr. Williams. I think that's great.
Sounds good.